On December 8, 2023, the FDA approved Casgevy, the first US therapy using CRISPR gene editing technology. This approval marks a paradigm shift in treating diseases at their genetic root. Casgevy targets sickle cell disease, a painful and life-shortening blood disorder. This milestone brings new hope for those living with this challenging condition. CRISPR offers the potential to cure diseases by fixing genetic errors. Sickle cell disease affects millions, causing pain, organ damage, and shortened lifespans. Traditional treatments have been limited and risky. Casgevy offers a new lifeline by editing the faulty gene responsible for the disease. This therapy aims to provide a long-term solution, potentially freeing patients from this debilitating condition. It signifies a transformative era in medicine where genetic diseases may finally be conquerable. Sickle cell disease, or SCD, is an inherited blood disorder. A single DNA error causes red blood cells to morph into rigid sickle shapes. These cells block blood flow, leading to pain and organ damage. Symptoms vary widely, from mild discomfort to severe pain and hospitalizations. SCD is a silent threat passed down through generations, causing immense suffering. Sickle cell disease stems from a mutation in the hemoglobin gene. Hemoglobin carries oxygen throughout the body, but the mutation disrupts this process. Misshapen cells block blood vessels, causing severe complications. This genetic glitch creates a cascade of problems, from pain crises to organ damage. The mutation's impact is profound, disrupting the body's delicate balance. Sickle cell disease affects every aspect of life, from education to mental well-being. Pain crises often land children in the emergency room, disrupting their lives. Adults face challenges in maintaining jobs and pursuing education. The disease shapes choices and limits opportunities. The emotional burden includes anxiety, depression, and a sense of hopelessness. CRISPR, a revolutionary gene editing tool, offers hope for genetic diseases. It allows precise changes to DNA, correcting typos that cause serious illnesses. CRISPR's journey began in bacteria, where it serves as an immune defense. Scientists harness this system to target and cut DNA at specific locations. The discovery of Cas9, an enzyme acting as molecular scissors, was a breakthrough. CRISPR holds promise for treating genetic diseases like sickle cell disease. A single DNA mutation causes abnormal hemoglobin, leading to sickle-shaped cells. CRISPR can potentially correct this error, restoring normal hemoglobin production. This tool can also insert new genes, delete faulty ones, or regulate gene activity. CRISPR offers a versatile molecular toolkit for precise genome modifications. CRISPR technology sparks excitement, but also poses challenges. Off-target effects, where CRISPR cuts unintended DNA, are a concern. Scientists work to improve precision and accuracy, developing better Cas9 enzymes. Delivering CRISPR to target cells involves sophisticated systems like engineered viruses. Despite challenges, CRISPR's potential to cure genetic diseases is transformative. Casgevy's journey from concept to FDA approval showcases scientific dedication. Clinical trials rigorously tested its safety and efficacy. For patients, the trial was a beacon of hope against sickle cell disease. Participants underwent a multi-step process, including blood stem cell collection. Scientists use CRISPR-Cas9 to edit the faulty gene in these cells. Dr. Monica Bhatia, a pediatric hematologist-oncologist, advocates for sickle cell patients. She led the Columbia team in Casgevy's clinical trials, treating pediatric patients. Dr. Bhatia witnessed the transformative power of Casgevy, bringing normalcy to children's lives. The approval of Casgevy represents a medical breakthrough and a triumph of human spirit. Dr. Bhatia sees this as a turning point in the fight against sickle cell disease. Our teachers, our future transformed patient stories. The true impact of Casgevy can be measured not just in scientific data and clinical trial results, but in the profound transformations it has brought about in the lives of real people living with sickle cell disease. Their stories, filled with resilience, hope, and newfound freedom, paint a vivid picture of what this groundbreaking therapy represents. Take, for instance, the story of Sarah, a young woman who had endured a lifetime of pain crises, hospitalizations, and limitations due to sickle cell disease. Growing up, she had always dreamed of becoming a dancer, but her condition made it seem like an impossible aspiration. The pain, fatigue, and constant fear of a crisis kept her on the sidelines, watching her peers pursue their passions. Then came Casgevy. Sarah decided to enroll in the clinical trial, clinging to a glimmer of hope that this therapy might offer a chance at a different life. The results were nothing short of transformative. Her pain crises subsided, her energy levels soared, and for the first time in her life, she felt a sense of freedom from the constraints of her condition. Sarah was finally able to pursue her passion for dance, her movements now filled with a newfound grace and joy. Sarah's story is just one of many, each a testament to the life-changing potential of Casgevy. These stories serve as a powerful reminder that behind the science and medical breakthroughs lie real people whose lives have been profoundly touched by this revolutionary therapy. Their experiences offer a glimpse into a future where sickle cell disease, once a life sentence of pain and limitations, may finally be relegated to the annals of medical history. Beyond sickle cell, a universe of possibilities. The approval of Casgevy for sickle cell disease marks a pivotal moment in medical history. It signals a paradigm shift, illuminating the vast potential of gene editing. Imagine a future where diseases like cystic fibrosis and muscular dystrophy could be treated at their genetic root. This is the promise that CRISPR technology holds. The human genome is a vast and intricate tapestry. CRISPR provides an unprecedented tool for manipulating this genetic code. It's like having a molecular scalpel that can excise faulty genes. The success of Casgevy serves as a powerful proof of concept, offering real hope for patients with previously limited treatment options. Section 2. Navigating uncharted territory. The challenges ahead. While the promise of CRISPR technology is undeniable, the path forward is not without its challenges. Ethical considerations, technical hurdles, and societal implications must be carefully navigated. Off-target effects and delivery challenges are significant hurdles. Unintended edits could disrupt healthy genes or increase cancer risk. Ongoing research aims to improve precision and specificity, Innovative delivery systems are crucial for reaching target cells. Ethical and societal considerations loom large. Hope for generations to come. The future of gene editing shines brightly. Casgevy's approval for sickle cell disease is a pivotal step forward. Imagine newborns screened for genetic diseases at birth and offered tailored gene therapies, children growing up free from cystic fibrosis, adults living full lives free from Huntington's disease. CRISPR makes this future possible. Innovation and compassion converge to alleviate suffering. The journey will be challenging, but the rewards are a healthier future for generations. Section 1. A triumph of science and hope. The FDA's approval of Casgevy marks a watershed moment in medical history. It's a testament to the power of human ingenuity, our relentless pursuit of knowledge, and our deep-seated desire to alleviate suffering. For those living with sickle cell disease, this approval is not just about a new treatment. It's about a transformation of their reality, a chance to live a life free from the debilitating grip of this inherited condition. Imagine a child born with the shadow of sickle cell disease hanging over their future, now given the opportunity to live a life free from excruciating pain crises, hospital visits, and the limitations imposed by this challenging condition. Imagine their parents, their hearts heavy with worry, now filled with a renewed sense of hope, knowing that their child has a chance at a brighter, healthier future. This is the power of scientific progress, the ability to take what was once considered an immutable fate and rewrite it, offering hope where there was once only despair. The journey to this point has been long and arduous, marked by countless hours of research, setbacks, and unwavering dedication from scientists and clinicians worldwide. But the approval of Casgevy is not the finish line. It's the starting point for a new era in medicine. It's a beacon, illuminating the path towards a future where genetic diseases, once considered insurmountable obstacles, may finally be within our reach to conquer. Section 2. A future written in our genes. The story of Casgevy is not just about sickle cell disease, it's about the dawn of a new era in medicine, an era where we have the power to target the root cause of genetic diseases and rewrite the very code of life. This power comes with immense responsibility, requiring careful consideration of ethical implications and the potential for unintended consequences. As we venture further into this uncharted territory, we must proceed with caution and wisdom, ensuring that these powerful tools are used responsibly and equitably for the benefit of all humankind. The development of gene editing technologies like CRISPR has sparked intense ethical debates about the potential for designer babies and the alteration of the human germline, changes that could be passed down to future generations. These are complex issues with no easy answers, requiring open dialogue, thoughtful deliberation, and the establishment of clear, ethical guidelines. We must ensure that access to these transformative therapies is not limited to a privileged few, but is available to all who need them, regardless of their socioeconomic background or geographical location. The future of medicine is being written in our genes, and the possibilities are both exhilarating and daunting. The approval of Casgevy for sickle cell disease is a testament to our capacity for innovation and compassion, a beacon of hope illuminating the path towards a future where genetic diseases no longer hold dominion over human lives. The journey ahead will be challenging, but the potential rewards, a healthier, brighter future for generations to come, make this a pursuit worthy of our greatest efforts.